Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Gerard from the Nursing Department here at Nassau Community College, along with my co-host, Pascal Thomas, who is completing her master's degree in nursing education. And today we're talking about hearing loss. Our guest today is Diane Nens, who is an audiologist with United Healthcare Hearing and advocate for hearing health education. United Healthcare is collaborating with a nonprofit group called Songs for Sound to launch a public awareness campaign letting people like you know how they can protect their hearing. Diane, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. Welcome.
Thank you. It's great to be here.
Okay, so Diane, so first, tell us about yourself and how and why did you become an audiologist and why did you choose to work with health and hearing?
Sure. So my name's Diane Nens. I've been an audiologist for over 25 years. And I first got into the field when I entered college. I entered for speech pathology. And I took my first audiology course, really was fascinated by the ear, the hearing, balance system, and just really wanting to help people who were going to need the help in years to come. Remembering way back, the Walkman was first introduced, and I thought to myself, there's probably going to be a lot of people in the future that are going to need help due to listening to music or, shows, what have you, much too loud.
Yeah, I often think about that as I pass, sometimes driving on the street, and you hear this booming sound coming from the next car with this loud music. What is the overall effects that this could have long term, this loud music? And how quick does it happen that you have these hearing losses when you're listening to music so loud?
Those are all really good questions. Well, what I will tell you is there's different types of loud noises. There's exposure to loud noise that can cause hearing loss quickly or gradually over time. Hearing loss can result from a single loud sound, such as a firecracker or a gunshot near the ear, or more often, hearing loss can occur over time from damage caused by repeated exposure to loud sounds or loud music. The louder the sound, the shorter the amount of time it takes for that damage to occur. The longer the exposure, the greater the risk for damage, especially when hearing protection is not used or there is not enough time for the ears to rest between exposures. So we do really include not only just environmental sounds, but listening to podcasts or music using headphones.
So is this hearing loss permanent when it does occur?
It is. And I'll just take a step back, if you don't mind, and I'll give the listeners just a quick overview of how we hear and how this really does impact our hearing.
Please, yes.
So first and foremost, we hear sound when delicate hair cells in the inner ear vibrate, and that creates nerve signals that the brain understands as speech or sound. But just as we can overload an electrical circuit, we can overload the vibrating hair cells. And up to 30 to 50% of the hair cells can be damaged or destroyed before changes in hearing can even be measured by a hearing test. So by the time a person notices hearing loss, many hair cells have already been damaged or destroyed and cannot be repaired. And thus that results in hearing loss and prompting people to obtain, a hearing aid for treatment. But what's important to note is that the type of hearing loss that we're talking about is called noise-induced hearing loss, and that's repeated exposure to loud noise. And to your earlier question, is it preventable? Yes, that is the only kind of hearing loss that is preventable. And there's three key facts that's important to note about noise-induced hearing loss. Number one, it's cumulative because the damage can start when we are young and worsen gradually over time. Number 2, it's invisible. We can't see it, so it can happen without our even noticing it until it's too late. And finally, it's permanent. So unlike a broken arm that gets better over time, we can't heal our hearing. Once it's damaged for good, and the only way to diagnose a hearing loss is through a hearing test.
So why is hearing so important, and how does this really connect to our overall well-being and our overall health?
Well, first, again, I'll lay the foundation just as the impact that it's having and further answer your question. So hearing loss is extremely common. It can affect anyone, regardless of age, and it is a significant health issue, and the numbers are bearing this out. Approximately 48 million Americans have hearing loss in at least 1 year, and by the year 2030, it is estimated that 51 million Americans will have the condition. So helping people keep or improve their hearing health is important because maintaining hearing or obtaining treatment if necessary may help people reduce their risk of falls and other health conditions associated with untreated hearing loss, such as dementia, depression. On the flip side, the health benefits of hearing well are often significant improvements with relationships, self-esteem, and overall quality of life. So it truly does connect. I mean, hearing is a bond, and it's a connection through communication. And when there is that hearing loss, truly impacts that level of communication.
So what 48 million in 1 year will have 48 million people. Tell me those statistics again. 48 million?
Sure. Approximately 48 million Americans have hearing loss in at least 1 year.
At least 1 year. How does these statistics buy into as the population ages? Is it age-related also, hearing loss, or is it only noise-induced? Or are you talking about the impact of both?
The impact of both. Mm-hmm. That statistic is hearing loss all-encompassing. Mm-hmm. So it can be, the cause could be age-related. It could be noise-induced hearing loss. There could be medical issues related to it, such as structure, deformities of the ear infections, medications, even genetics. So it's all-encompassing.
Okay,
interesting.
Good. One of the statistics I saw in the work environment with hearing loss, the condition reduces household income by an average of $12,000 per year. Can you explain this?
Sure. Well, what happens is in the workplace, people are impacted. So especially, let's say, for example, the employee does not wear hearing aids. They've not taken those next steps to, seek treatment. Communication is impacted. So hearing on the phone, hearing in meetings, maybe it's a large auditorium. So the distance from the speaker, to the individual's ear is greatly increased. So, or decreased, I should say. The distance is decreased, making it very hard to hear and understand. So we take our hearing for granted when we have normal hearing. All those daily tasks that are required at work, we take for granted. We're not working extra hard to overcome some background noise or overcome the distance from that speaker. So it truly does impact those employees.
So is hearing loss familial? Is it have a genetic component to it?
It most certainly can. I don't have the statistics on genetic losses, but yes, there definitely is genetic hearing loss.
And so we see that hearing loss is more predominant in the older adult than the younger? Or is it kind of equaling now with the trend for loud music? Tell me what you're seeing.
It used to be very lopsided. I guess when I was back in school many years ago, it was considered, hearing loss was considered more age-related, if you will. Again, I don't have these statistics for the younger folks, but yes, we are seeing hearing loss on the rise, and even with those younger individuals due to, lifestyle choices, meaning exposing themselves to loud music, to noise more often.
So how can we tell that our hearing is dwindling or that we're having some losses? Because sometimes we're in denial, or I see patients that are in denial. They say, "Oh, I can hear perfectly fine," but you see the tendency for the head turning to one side when you're trying to talk to them. What are some of the signs?
Sure. So some of the signs of hearing loss are difficulty understanding speech, asking people to repeat themselves or speak louder, difficulty hearing in crowds and noise, turning the volume up on the TV or radio, difficulty hearing on the phone, and if speech sounds muffled, that's another sign. And I will tell you that many times, because hearing loss typically is gradual over time, the brain adapts to hearing the way that they are in that state. The individual themselves doesn't necessarily recognize hearing loss early on. Many times others around them notice it before they do. So I would just really encourage the listeners, if they themselves are experiencing hearing loss, any of those signs, or maybe others, loved ones are telling them that they need to repeat more often, etc. I really encourage them to seek treatment, meaning talk to their doctor, get a hearing test scheduled, and that way they can find out where they do stand with their hearing.
Do you recommend the buds, the earphone buds that are very commonly used these days? I see them being used as people are working out or just commonly used in their everyday lifestyle. Do you recommend them that direct application to the ear for hearing music or anything else, radio, whatever?
I think everyone has to really use caution, be very sensible when using any type of headphone, whether it's over the ear or the earbuds. What I like to tell my patients over the years is that if others around you can hear the music, it's too loud.
It's too loud.
You're at an unsafe level. So listening at softer levels, many times people don't enjoy as much. They like to really listen to the music louder, but it's the duration as well, too. So giving themselves some breaks, that way their ears can recover and then listen again, but just keeping in mind what level they are listening to. So if others can hear the music, it's just much too loud.
Okay, good. Can you tell us what are some things that we can do to protect our hearing?
Well, number one, avoiding noisy situations is, of course, the best prevention. But if you can't avoid the noise, using ear protection is highly recommended. And there are many steps that people can take to prevent hearing loss or treat the condition if they're currently experiencing it. At United Healthcare Hearing, we recommend follow the 60-60 rule, which means limiting the use of earbud headphones to no more than 60 minutes at a time and no more than 60% of the player's maximum volume. We also recommend limit the exposure to loud sounds such as music, lawnmowers, or motorcycles to no more than 20 minutes at a time. And when attending concerts or sporting events, consider wearing hearing protection. And finally, talk to your doctor or hearing health professional and schedule a hearing test. Because, again, they may be missing the fact that they do have some hearing loss. And the earlier that hearing loss is detected and treatment is given, the faster, their treatment will most certainly be incorporated, and it will impact relationships more positively.
Okay, let's take a quick break. My name is Dr. Jeanine Cook-Gerard from the nursing department here at Nassau Community College, along with my co-host, Pascal Thomas, who is completing her master's degree in nursing education. And today we're talking about hearing loss with Diane Nens, an audiologist with United Healthcare Hearing. You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.
Hi, I'm Dr. Lamre Falusi with today's tip for kids from the American Academy of Pediatrics. Did you know that tooth decay is an infection? Luckily, cavities are largely preventable. The bacteria that cause cavities pass from parents to children, so good oral health is a family affair. Take care of baby teeth as soon as they emerge by brushing them with a smear of toothpaste with fluoride. Talk with your pediatrician about your baby's oral health and take him to the dentist by age 1. For more, visit healthychildren.org.
Have you ever borrowed money to finance gambling? Is your life a nightmare from the downhill spiral of compulsive gambling? Gamblers Anonymous helps people worldwide who have a gambling problem to return to normal, happy lives. There are no dues or fees for membership, only the desire to stop gambling. If you are one of the millions of Americans suffering from this problem, act now and get immediate help by calling the Gamblers Anonymous hotline at 855-2-CALL-GA. That's 855-222-5542. Remember, help is a phone call away.
We now return to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.
Thanks for being with us today. This is Dr. Jeanine Cook-Gerard from the Nursing Department here at Nassau Community College, along with my co-host, Pascal Thomas, who is completing her master's degree in nursing education. And today we're talking about hearing loss with Diane Nens, an audiologist with United Healthcare Hearing. So welcome back, Diane. So can you tell me, we're talking about this hearing loss. Is there anything that we can change in our diet that would improve our hearing? Any nutrients in particular?
Sure. This is actually an exciting topic for me. When I think about nutrition, it's a big part of our culture and has evolved really into focusing into health and fitness. But something that most people don't think about is focusing on the hearing health when it comes to diet. So I do have some recommendations. And first and foremost, cooking mineral-rich, vitamin-packed meals from scratch can help protect hearing health. And there's 4 minerals in particular. Number 1, potassium can be important to hearing health because the fluid in the inner ear, that part of the ear that translates the noises we hear into electrical impulses the brain interprets as sound, is dependent upon a rich supply of potassium. Number 2, folic acid is a critical element in the body's ability to generate new cell growth. And also, people pre-treated with magnesium, along with vitamins A, C, and E, were protected from noise-related hearing loss. And finally, zinc. Zinc boosts the body's immune system and is also responsible for cell growth and healing wounds.
So it sounds like a diet that is full of probably vegetables, beans, legumes, potatoes, those kinds of foods would probably help with in terms of our improving hearing. Does it actually improve hearing, or does it decrease your chances of your hearing declining?
It protects your hearing. So, yeah, exactly. It's more of a protective mechanism.
And so would you say that patients who are malnourished will probably have a decline in their hearing?
Well, I believe that there's other factors involved in that, genetic disposition, environment, lifestyle. So most certainly it would be helpful for those to incorporate the healthy diet, but I don't know that it would create more hearing loss.
So tell us, I see these hearing aids, and they're becoming smaller and smaller and less visible. Are they better in terms of allowing the patient to hear clearer? What is the technology now?
Well, I'll start by saying that the hearing aid industry is ever evolving and changing, and we most certainly have seen a trend in the past few years in that technology, style, and even cost has really changed. In all, I will say for the positive for the consumer. So really, a hearing aid is dependent on the individual. So not only maybe the anatomy of the ear, how small, how large, but also their hearing loss. So when a individual goes to their audiologist or their doctor and talks about hearing aids, there will be some very important considerations, as I just mentioned. And what hearing aids do is that they actually add volume to the sounds that are important for understanding speech. And again, it's based on each individual's hearing loss. But overall, what I can tell you is they automatically vary the amount of amplification, allowing an individual to hear soft sounds while keeping loud sounds at a comfortable level. So that's the main gist of hearing aids, and then there's all kinds of technology out there. I mean, we can most certainly use Bluetooth capability, stream to their phone, to TVs. So we've come a long way over the past few decades.
Okay, could you tell us more about the collaboration United Healthcare has with Songs for Sound and protecting their hearing?
Sure. So as a part of working with Songs for Sound, they are, as you mentioned earlier, a national nonprofit dedicated to improving access to hearing health care. We produced a public service announcement to help people understand the connection between noise exposure and hearing loss, to spread the message that there are steps that can be taken to preserve hearing. So we were just thrilled to work with this wonderful nonprofit. This nonprofit is a heartwarming story with a passionate objective, and their objective is to provide awareness of hearing loss solutions, access to hearing testing and devices, and to encourage action for those suffering from hearing loss.
So, what are some tips you can give us as listeners to prevent hearing loss? You talked about diet, and you talked about staying away from these loud noises. Is there anything else that you can add to that?
Well, it really is about our environment. It's about our listening habits. So noise is the biggest culprit. This is what we're talking about today. As I guess October, I should mention, October is the National Protect Your Hearing Month. So again, here to provide awareness about noise-induced hearing loss, and again, prevention strategies. So it really would be, if using, listening device, personal listening devices, following that 60-60 rule, which I mentioned, and it sounds long, so I'll just repeat it one more time. And that means limiting the use of earbud headphones to no more than 60 minutes at a time, and for no more than at 60% of the player's maximum volume, and limiting exposure to loud sounds, as we talked about, using ear protection, and finally talking to your doctor. If you have any signs or symptoms of hearing loss, always best to talk with the doctor and then also get a hearing test scheduled.
So what is a hearing test? What is that like? If I were to go into my physician and get a hearing test, what should I expect?
Sure. Well, first and foremost, there would be a case history, asking questions about your ear history. There would be an otoscopic exam, so looking in the ears with an otoscope, making sure that there's no wax occluding before a test is given, among other things. And then the test consists of tones. So you'd either press a button or raise your hand when you hear the tones. And there's some tests where you repeat words, because that gives a lot of information if the individual can understand words clearly, or if that's even muffled for the individual. And then the results would be given. And then again, if you needed to see a doctor, maybe there's a medical issue at hand, to see your internist, your PCP or ENT, or to see an audiologist to discuss hearing aids.
And the hearing aids that are recommended, are they covered by most insurances, or is this basically out of pocket?
That varies.
Okay.
So at, United Healthcare, many of our members do have a benefit towards hearing aids. And there are other insurance companies that most certainly do as well, too. So what I've always recommended is every individual, if they're not sure, call their health plan and just ask about their allowance or their hearing aid benefit.
So when we're getting back to that, the Songs of Sound, where did that title come from, that Songs for Sound, the non-for-profit?
Sure. I can tell you that my take on that is when the family who started the foundation was trying to find answers for their daughter who had hearing loss that wasn't diagnosed right away. They had searched out several appointments, really looking to identify if she did or did not have hearing loss. I believe the Songs for Sound is just that many people with undiagnosed hearing loss do miss out on music. And I don't know if her daughter has a great love for music, but I know that hearing loss does change the ability to hear and enjoy music.
What is your website for people to get more information about Songs for Sound?
Sure. So Songs for Sound is songsforsound.com, or the listeners can visit our website, UnitedHealthcareHearing.com, which is UHCHearing.com. If they, they or a loved one are experiencing hearing loss, or it's been many years since they've had a hearing test, really important, again, to talk to your doctor, schedule a hearing test.
How common is it for a person to come into your office and just need their ears cleaned because of a buildup of wax in the ear?
That percentage is going to be low. Patients will typically see their primary care physician or their ENT most times for that, but it does occur because not everyone is aware that they have that. Some audiologists do remove wax, some do not, and they all have their own reasons for doing so. But again, if one would go to an audiologist or hearing aid dispenser that does not remove wax, they would most certainly recommend and refer that patient out to their doctor.
And does wax significantly decrease the person's ability to hear, or is it minimal? In terms of
that varies. It depends on how much wax is in the ear. So it definitely impacts the hearing, and definitely a situation where we don't like to test hearing. We want to make sure that the test results are accurate. So again, because when we look in the ear, we cannot see behind all the wax to see how deep that goes. So it can maximally affect it as well too if there's a large plug.
Okay. Diane, are there any parting thoughts that you would like to leave our listeners with?
Also wanted just to mention that United Healthcare has also donated silicone reusable earplugs to firefighters and first responders across the country. To help protect the hearing health of the first responders. So we were excited to participate in that as well. And again, I would just really encourage the listeners that if they are experiencing any of the signs of hearing loss, don't put it off. Go ahead and make that appointment to have a hearing test.
Well, thank you so much for being with us, Diane Nens, an audiologist with United Healthcare Hearing. This is Dr. Jeanine Cook-Gerard from the nursing department here at Nassau Community College, along with my co-host, Pascal Thomas, who is completing her master's degree in nursing education. And we thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to WHPC@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the nursing department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.